This past week certainly has been very stressful for us here, but it's really been heartening to see how our community, has come together to support one another, to make sure we take care of our patients. Fortunately, our campuses at the VA and UCLA and all of you were not directly impacted by the fires, though many in our communities have been impacted. So we're here today to be available to all of you to share what we love about our program here at UCLA. And I think, this past week was an example of what an amazing community we have in our program. We're here because we're invested in recruiting more amazing residents to our program. And so look forward to sharing with you all more details about our special interest tracks. So we're going to get started with the Clinician Educator track. I'm going to go ahead and share my screen. We have several residents joining us today. You'll meet the track leaders for each of our special interest tracks as well. And the format will be about 30 minutes per track. We'll give you a brief overview of the track. We'll ask some of our residents to share their experiences. And we want to answer your questions, so please feel free to chime in or put questions in the chat. All right. Okay. So starting off with the Clinician Educator track, I lead this track in our program. You all know me. I'm Adrienne, the program director. The goal of the Clinician Educator track in our residency is to prepare those residents who are interested in pursuing careers in academics, really with a focus on teaching and curriculum design and development. So our objectives are to improve our residents' teaching skills. Our residents really get a lot of hands-on experience with this, teaching each other as well as medical students, off-service rotators from internal medicine or psychiatry. And so honing those teaching skills is one of the goals of this track. We also engage our residents in scholarly work pertaining to a medical education project. You'll hear a little bit more about some of those projects. We also have a medical education elective as part of the residency, where we facilitate opportunities to practice your skills as educators, whether that's with undergrads, medical students, interdisciplinary teaching to other specialties, or allied health professionals. As with many of the tracks, in order to earn a certificate of distinction at graduation, you have to attend at least 2 of the 4 quarterly track meetings per year and participate in the 2-week medical education elective during the PGY3 and or your PGY4 year. And many of our residents who are interested in pursuing this track do a medical education elective in each of those years. We'll also tell you a little bit more about the David Geffen School of Medicine's Medical Education Fellowship, which is optional, but certainly is an amazing opportunity that our residents are afforded to participate in collaboration with our leaders in education at UCLA. And lastly, we hope that you present the work you've done in this track, your education project, at Collins Day, which is sort of our annual trainee day where we highlight the research, the accomplishments of the trainees in our program. We have an invited dinner speaker. It's really a celebratory event for the whole department and its trainees each spring. So I mentioned the Medical Education Fellowship, which is a certificate program that's run through the School of Medicine here at UCLA. There are 2 years, with the first year focusing on innovations in curriculum design and evaluation. You learn principles of adult education theory, an approach to designing and implementing a curriculum. The second year, which is optional, is more focused on medical education scholarship. So if you want to study your education intervention, this will give you the tools and techniques to approach that. Joining us today are some of our residents. I just wanted to highlight here some of our current and recent participants in the track and some of their projects. We told you a bit during the interview day about the PGY2 boot camp, and we have one of our chief residents, Alvin Singh, who's working alongside one of our PGY3 residents, Adnan Hussein, in implementing this project. So we can hear a bit more about that. Another one of our residents this year, Amir Mulai, is also doing a project looking at 3D printed neurovascular models as a way to help teach intracranial arterial anatomy. And so that's been really fun working with 3D models. And you can see several of the other projects that have occurred over the years. We have one of our alumni and current headache fellows, Molly Fensterwald, joining us this evening to tell you about her project developing simulation sessions to teach management of neurologic emergencies to our residents. The Sim Center at UCLA is brand new, actually, and just reopened this last year, and is an amazing resource for using simulation in medical education, whether it's with our students or our residents. We've really taken advantage in our curriculum of the resources provided by the Sim Center. For example, we've done simulation in practice delivering functional neurologic diagnosis or neuropalliative care simulation. And so it's really an amazing resource for learners at all levels. We have quarterly meetings, as I mentioned, for each of the tracks. And in the Clinician Educator track, some of the things that we've included during those meetings, including like a career panel to discuss career pathways in medical education. We've done different types of workshops to develop specific teaching skills. We also sometimes use our track meetings to brainstorm ideas or get feedback on projects that are ongoing from participants in the track. We also sometimes use this time to have a journal club focused on a medical education journal article. You can always reach out to me if you have other questions about this track. But without taking up any more time, I wanted to invite some of our residents who are here to share their experiences. So Alvin, you're first on my screen, so maybe I will start with you.
Hi, everybody. Nice seeing you all again. I'm Alvin, one of the PGY4 chief residents. Nice meeting you all. So yeah, I just briefly wanted to chat about the boot camp that we implemented. This was about 2 years ago. So we created a neurology boot camp kind of to make the jump between PGY1 and PGY2 smoother and less stressful. The idea was to kind of focus on key skills and knowledge that PGY2s really need. So we built a curriculum with interactive lectures, hands-on workshops, and simulation training as well. Shout out to Molly for her project to help build on it as well. So yeah, it was really great. We addressed kind of specific milestones and overall, improved preparedness and streamlined that transition. And we were lucky to share this project at the AN annual meeting last year as well. Dr. Fu presented on my behalf because I was on paternity leave. Thank you, Dr. Fu. But yeah, it was a really incredible experience that we were able to kind of have it recognized at the national level as well.
Yeah, thank you, Alvin. And Molly, maybe you can tell us a little bit about sort of yourself and your project and participation in the Medical Education Fellowship here.
Yes, hi everybody, I'm Molly. I'm a current headache fellow. I also did my residency at UCLA and was a chief resident a couple years ago. So I thought I would just share a little bit more about kind of doing the more formalized education fellowship through the School of Medicine, which was something that I did in addition to the Educator tract. But this is something that actually Dr. Fu did as well, so she can chime in as well. She did 2 years of it. It's optional to do 1 or 2 years of it. So this is a program that you apply to through the School of Medicine. It's open to residents, which is really awesome. It's also open to fellows and even faculty that are interested in doing educational projects and activities. And it's structured in a way where you basically attend lectures a couple times a month for during the duration of the year. and you kind of learn about more formal education strategies and how to teach. They go over like learning theories and kind of a more formal education. And then you also at the same time build on a curriculum project that you come up with, based on areas of need, or, there's a whole range of different projects. But as a resident, I was wanting to, add to our resident education. So the project that I worked on was expanding on our simulation cases that we use through the simulation center, just because we have access to this awesome simulation center, and the ER residents were using it all the time. We did stroke simulations at the beginning of our training, but my project was sort of to expand on it. So add on things like looking into hemorrhage cases, status, like other neurologic emergencies that we see early in residency, just to get, feeling more comfortable with it and kind of have an idea of the process. So that was sort of the reasoning behind that project. But it's awesome to see, like to do the education track or to do the formal program and come up with a project that you can see continues on and continues to improve the program, years on. So it's exciting because now the cases are still incorporated into the curriculum, as Alvin mentioned, and are part of boot camp and part of the early like didactic training.
Thank you so much, Molly. Also joining us today to talk about his experience in the track is one of our current PGY3 residents, Sebastian Green. Hoping he can join us because he's about to be on call this evening. So let's make sure he gets in before 5 p.m.
Thanks, Dr. Keener. Hi, everybody. I'm Sebastian. I'm a PGY3. Just wanted to briefly share my experience on the Clinician Educator track. I haven't started a project per se. I've really been focusing my time engaging with the international podcast community. So I actually joined the Clinical Problem Solvers, who are largely based out of UCLA, by one of my preceptors from internal medicine. A lot of you might have heard of it. It's pretty internationally famous. Each podcast has about usually 10,000 listens from about 50 countries around the world. So I've joined the Academy of the Clinical Problem Solvers, and I share cases from UCLA, which I bring forward, and then my colleagues discuss it all live on a YouTube stream, and then it gets put on Apple Podcasts and Spotify Podcasts, but also as a discussant. So I hear other people's cases and try and solve them with Aaron Berkovitz, who's usually the host of the session. So it's been wonderful, and I've been allowed to do it because of the medical elective time that I took during my PGY3, and then have been able to reflect on it through the Educator track. I've done a few other smaller projects, but I think that's the main one and the most exciting one for me to share with all of you.
Thank you so much. And lastly, I think I'd like to introduce one of our current PGY4 residents and chair of our resident wellness committee, Dr. Mita Kara, who's sort of as part of wellness efforts in the program, also undertaken an education project. So Mita, maybe you can tell us a little bit about that.
Hello, everyone. I'm Mita. Thanks so much, Dr. Keener. So I've had a little bit more of like an atypical, I guess, progress through the track, but I've been really grateful for the chance to work on a whole host of kind of wellness initiatives, and then studying the impact of those initiatives as we've applied them over the years, and kind of tracking, seeing which one of them have been more effective, what are ways that we can improve, and how can we make them a sustainable part of the program for years to come. And so things that we've looked at as part of that have been regular scheduled resident community events. So that offloads, the effort from residents and just provides a space for everyone to meet outside of the hospital, decompress, share with each other. So that's one thing. Also, we've implemented a longitudinal didactics. So throughout the year, bringing in invited speakers, but also focusing on topics like burnout and learning about tools like mindfulness, and even implementing resident-led projects for specific things that they feel would further wellness. And then this year we are experimenting with a new initiative, which is the Coffee with a Colleague program, and that's a peer support program that we're extending to all residents, where they can just have a dedicated time over coffee to chat with a co-resident who's received training in empathetic listening and resources that they can refer their co-residents to. And so this is, we're tracking with both pre and post-implementation survey-based research. And I was grateful to present this at our recent Education Day as well.
Yeah, thank you so much to all of our residents and alumni who have shared their experiences in the track. I want to open up some time for questions. So if any of our applicants have questions about anything they've heard about so far, feel free to unmute or put a question in the chat. And if you don't, that's okay too. I have some questions prepared I could include. Maybe while everybody's thinking about that, I'll actually invite
I
Dr.
think Phoebe
Fu.
has a question,
Oh, great.
actually. Yeah,
Thank
I
go
have
ahead,
a
Phoebe.
question. Sebastian, how did you get involved with Clinical Problem Solvers? That is such a phenomenal podcast. Just can you talk more about how you got involved?
Yeah, of course. I'm happy to. So we're lucky enough at UCLA to have Reza Manesh as part of our internal medicine faculty, and he was one of my mentors and preceptors during my intern year, which I did at the West LA VA, which is part of the neurology categorical training program. So yeah, I worked with him and expressed an interest in medical education, and he invited me to do a few smaller projects at the VA and also at UCLA. And then they went very well. So, pulled me aside one day. We had a sort of career chat, and he said, "Look, are you interested in medical education?" I said, "Absolutely." And he said, "Great. Well, do you want to join the team?" And that was it. So luckily, it was just sort of right place, right time that Dr. Manesh happens to be here, and he's obviously one of the founders of Clinical Problem Solvers. So that was it. But there's a very wide and active medical education community here at UCLA beyond Dr. Manesh, who are doing lots of other projects. But yeah, right place, right time.
Yeah, I think, Paul, go ahead. I think you have a hand raised there.
Thank you so much. I was curious if you could talk a little bit about the balance between creating your own projects or coming up with your own idea and implementing it versus like jumping on projects that are already going on with faculty.
Anyone want to comment on their experience?
Sounds like a research track question.
I think I will say, I think some of the ways that these projects have evolved over time have included sort of group efforts or passing the baton as people graduate as well. And so certainly, I think the more the merrier. I think I'd love to hear from our residents sort of how they came up with their projects. I think they reflected a little bit on that. Part of it, I think, is what you're interested in, what gaps you might perceive exist, especially if you're trying to develop something in our residency program. I feel like our residents come up with great ideas all the time, and we're happy to facilitate those. But I know, they're always looking for help in implementing these projects. So yeah, if anyone wants to share sort of their experience with creating a new project, or Alvin, you had another resident join your project this year. Maybe you can talk a little bit about that, how the iterative sort of process of doing it, years in a row has gone.
Yeah, Adnan, when he really took a lot of initiative and took the reins this past year. This was the second iteration of our boot camp this year. And we really wanted, he really took initiative to like bring in the perspective of, he was the first class to do the boot camp. So what was things that he experienced and really wanted to build on. So in of itself, it was kind of a quality improvement initiative. We helped add on to the boot camp and revise and refine certain things. Like, for example, The first year we only had a stroke simulation, and then Adnan added the status epilepticus simulation to this year. And we did a couple other things, like including a wellness session that Mita helped with as well. So this was a really collaborative effort. It was really, really cool. It was a little bit of each of us, of our residents, in one really collaborative effort.
I can chime in on from like a mentorship standpoint, answer Paul's question. Yeah. So I think there are plenty of avenues for people coming in and how they, sort of end up deciding on their projects. There are people who have come in with some experience, from medical school, and they want to sort of continue that work. They chat with us as faculty mentors, and we try to adapt and see if there's a space for some of that here within our program. And once again, I think there's a lot of opportunity. We have connections with undergraduate organizations, medical students, residents. So there's a lot of opportunities there. I think the second one that is relatively common is our residents identify a gap or something that they would like to see more of. Examples of that have been the procedure elective, Molly's simulation project, Alvin with his boot camp, among many others. And they're like, I want to fill this gap. And along the way, I also want to learn for my own benefit. And that's fantastic. And we very much support that. And there are some people who are like, I have no idea, but I would love to get involved in a project. I am having now completed the second year of the medical education fellowship, which is on medical education scholarship, and now pursuing a master's in education. I'm really trying to build up that sort of project pipeline for medical education. And so I have lots of ideas for projects, simulation, AI, curriculum development. We have 5 different longitudinal curricula, as have been mentioned. All of them have a lot of potential to improve their evaluation assessment strategies. So honestly, the sky is the limit. So if, and so I sort of present the overarching sort of categories to you. You can think about it and see if there's any particular area you're interested in. We can chat more and go from there. So lots of opportunities, really exciting. Yeah, we all love it.
Kat, maybe you can share a little bit more about what the second year of the Med-Ed Fellowship has been like.
Yeah.
And I will also just give a shout out to Kat. Through this work, she's presented these projects at national meetings, ACGME, AAN, and also published some of her medical education work. So tell us a little bit about year 2 of the Med-Ed Fellowship.
Yes. So year 2 of the medical education fellowship tends to be a smaller cohort. I remember my year, I think there were only about 6 people. And I think that's sort of relative to interest as well. So I don't think it's only limited to that small of a cohort year to year. But that was my experience. It is nice to be in sort of a more intimate group. MEF1 is much larger of a group. But it's really focused on methods in medical education research, which has some overlap with, I think a lot of us who have done sort of some scientific or clinical research in the past are very familiar with, for example, quantitative methods, which is still implemented in medical education research, but they also introduce you to qualitative methods, more, sort of interview-based or narrative, text-based education research, which is very different from quantitative research and still something I feel like I'm learning more about from a methods standpoint, mixed methods research. And of course, with this fellowship, you develop and design your own research project and try to carry it through to completion as part of this year, which is very exciting. This year, as part of actually both MEF 1 and 2, that program is always improving itself. And so this year, I know that they've asked some alumni to serve as thought partners, which are basically mentors. I think actually both Adrienne, myself, and Molly, I think I saw you on a mailing list, have been asked to serve as thought partners for MEF fellows in years 1 and 2 to provide them with an extra layer of support and mentorship, which has also been excellent both for the fellows and for ourselves to stay engaged in that wonderful program. But yeah, I'm happy to answer any questions for those who might be interested in that education research side of things too.
I will say, I think one of the benefits of participating in the fellowship, at least for me, was the networking with other educators in other departments in the School of Medicine. So, you know, it just sort of, you know, like-minded people excited about education. It's really interesting to see what other people's projects are. You know, I think inspires you and makes you think like, that's an idea that maybe I could bring to our department. You know? So I think sort of building that network within our institution across departments was sort of, I think, a secondary benefit for me for participating in the MedEd Fellowship. Great. We have a few minutes left here and we'll transition next to the research track. But anybody have any final questions, or any of our residents want to share any final comments?
Just one quick question for Sebastian again. Did you have any experience with podcasting or, you know, social media like YouTube before, or is that something that you sort of just picked up on the job?
No, it's something I just picked up on the job, and it's very weird. It was very weird hearing myself, you know, talk and be recorded for the first time in December. But yeah, no, it didn't. Dr. Manesh has like a full recording studio at the VA in his office, but I just actually use my laptop, and then they edit it and throw in adverts that obviously I don't get any royalties for. But no, very much just happens. Yeah.
That's awesome. Thanks.
Yeah, I think as our worlds of, you know, modalities of education have expanded, you know, whether it's podcasts or like tutorials, or, you know, there's so many, I think, novel ways to find, to educate and to communicate. And yeah, Sebastian is our sort of local movie star, podcast star.
On the topic of podcasts, we have also had people be involved in the like Neurology Minute podcast. One of our alumni is now like a pretty regular host on the actual neurology podcast. Shura Roy, one of our former chief residents, and then the Neurology Nuts and Bolts podcast as well. So we have connections to other podcasts for those interested in podcast work. And once again, if you don't have too much experience, you know, I myself did not, and you kind of pick it up, you get some tips. You heard from Sebastian too. So for those interested in that, there's opportunities here for that as well to get into those connections.
I also had a tiny question last minute, sorry.
Yeah, sure.
I've seen residents take part in journals like Green Journal, like Continuum, like editing, and on the resident and fellow section. And do you have like any particular paths for that? Have you ever had any experience with any residents who went down that path?
If
Yes,
only
I'm
we
gonna
knew an
let
editor
Dr.
for that section.
Yeah, I'm gonna let Dr. Fu answer this question.
Yes, so I am now the section editor for the Neurology Resident Fellow section. We also have one of our PGY3 residents who is an editorial board member of the Resident Fellow section. And I mean, for me, my path to that section was they put out a call. Dr. Flippin sent out an email. I was like, this sounds fun. Let me apply. I was accepted, and, you know, things kind of took off from there. So while, you know, I can't say like, you know, I try to really not be biased in the selection process, but I think we encourage our residents to, of course, apply for any opportunities. I think Continuum actually has an active call out for their editorial board and for a trainee. So if you see any opportunities like that, we encourage you to apply. We'll, you know, write your letter of support. We'll give you kind of, you know, happy to review your application, give you tips and things like that. And if you don't end up on an editorial board, at least speaking for the resident fellow section, we encourage everyone to be a reviewer. So you can sign up, you can look at our website, sign up, we'll start sending you reviews, and you will learn as you engage in that process. And so, you know, myself as a section editor, I think our residents have sort of extra access to me as a potential mentor if they really want to have someone walk through, you know, their reviews with them and learn about the peer review process. I'm always happy to talk about that. And so, yeah, so hopefully that answers your question.
All right, great. Thank you all for great questions. We'll transition a little bit now to talk about our research track. So I'm going to share my screen again. All right, so I would like to introduce Dr. Bill Flavin, as well as Dr. Jason Hinman, who are the leaders of our research track. I think Bill is going to lead things off, so just tell me when you're ready for me to advance the slide.
Yeah, thanks for sharing. Go ahead. So great to meet everybody. My name is Bill Flavin. I'm a current fellow in sports neurology. And if you don't know what that is, I'd love to teach you about it. But I'm also a fellow in the research track, having luckily earned a spot on the R25 slash now called UE5 training grant that UCLA has. And so I'm also in most of my time doing postdoctoral basic science research in a lab where I am right now. So love to tell you about the research track that we have. I think UCLA Neurology is a phenomenal research institution, and there's a robust neuroscience research community beyond our department in neurobiology and in other affiliated departments on campus. So you really have an opportunity to interface with one of the leading public research institutions in the country. Our mission, I think is somewhat self-explanatory. We want to be a leader in discoveries that advance knowledge, treat diseases of the nervous system, and we want to leverage that knowledge toward improved patient care. We think of ourselves as educating future physician scientist leaders of neuroscience, and we want our patient care to be evidence-based. We want innovation in our research so that we can educate the community. Ultimately, it's advancing neurological care through research discoveries, and we developed this pathway to facilitate that. If you care to look at the QR code, that's a link to our website, which is mostly updated. There's a few things that are out of date, but we try our best to keep it up to date in a rapidly evolving track with people moving through it all the time. Go ahead, Adrienne. So some goals. We want to understand how best to get involved in postgraduate neuroscience research. Many of us in the track have been involved in research in our prior positions in medical school. Some of us were involved in formal training, like an MD, PhD dual degree program or a master's degree program during medical school. There are even programs at UCLA where folks who've gone through medical training are interested in earning a PhD as a postgraduate physician, basically, and that can be done through the STAR program at UCLA. So people get involved in research at all different stages, and we want to encourage people to consider careers in academic neurology, other research-oriented careers beyond academia and industry, et cetera. So our pathway helps to provide resources, illuminate, goals along the pathway. How can you form those professional connections that will lead you to a place of independent, impactful neuroscience research? So we have a website, as I mentioned. I've been co-leading this track with Dr. Hinman, who's also on the call and happy to answer questions at any point. We have shared resources with folks in the track, prior grant applications, discussions, and connections with faculty that are involved in exciting research projects, and we know our good mentors. And we try to have quarterly meetings, just like every other track within our residency, where we talk about relevant topics. Finding a mentor is always a big one, especially for folks coming into our department as residents or other trainees. But as you move on, grant writing, reviewing grants becomes more important, thinking about how your own writing will be critiqued, and giving your own research lectures, presenting your works in progress, and interacting with other folks, even postdocs who are not physicians, graduate students. You get back into laboratories, and it's a melting pot of folks from all different pathways, and that's what makes research exciting. So it's a robust environment. So one thing to tell you about is sort of the formal program that we've been a part of. We've been lucky to be a part of through NINDS, which is the National Institute of Neurological Disorders and Stroke. They have formerly had a fellowship called the R25. It's now known as the UE5. And there's only certain institutions around the country that offer this training grant pathway. And you can follow this QR code to the website for that fellowship program broadly through NINDS, and you can make a list of all of the different residency programs that offer this training grant pathway. But I think NINDS has thoughtfully designed a protocol for neurologists, neurosurgeons, neuropathologists, other folks in other disciplines that are doing neuroscience research to continue to interface with the research community even during their clinical training, and then springboard that clinical training into translational research that will have a clinical impact soon after their clinical training. So this is meant to bridge a gap between prior research experience and post-clinical training, something that you'd be doing after residency. There's obviously a critical need for more physician scientists, people that understand what patients go through when we're designing research projects. And we look at it as almost a stepping stone to bigger and better career development awards, such as a K award or an R1, these bigger NIH-sponsored research awards that you could earn in your career. There's one of the highlights for me has been the annual meeting of all awardees for this grant and the site PIs. So this is a group of department chairs, research vice chairs from all over the country from these institutions that have earned these competitive training grants. This year, we're honored to be hosting that meeting here at UCLA in March. So everyone will be flying in and will be on our campus to present their work, you know, posters, grant, mock grant writing and things like that. And we broadened this program. It used to be centered within neurology, and then there was a separate program within neurosurgery. And over the last couple of years, it's been broadened, and we incorporate trainees from other residencies and fellowships as well. So I think it's been only made better over the time that I've been lucky to be a part of it. So this is the an example timeline of how you might be progressing through this track. If you're someone interested in the track, you've had prior research experience, you want to gain research experience really during your intern year, and your first neurology year, PGY2, you'd be thinking about mentors, thinking about projects. That question that was asked earlier about how you bring your prior experiences to the table and think about how that can match with mentors and ongoing projects versus charting your own path. These are discussions that we try to have with members of our track throughout their training and help to pair them up with appropriate mentors. The grant is written kind of at the end of PGY2 and at the beginning of PGY3 and is submitted in the fall NIH deadline, October, although there's an internal review process that wants you to finish it earlier toward the end of August. But it's right at the beginning of PGY3 where you'd be applying, and you usually find out in the springtime whether that grant was successfully funded. But you begin the research sometime during the PGY4. I illuminated it here for the way that most of us do it, which is the final 6 months of residency, because then it can be contiguous with the fellowship time. But there have been grant recipients to do that 6 months of research right at the beginning of PGY4 or in the middle. There's flexibility in it. I think because we're a medium to large residency program, we've been lucky that building those schedules has been possible with some of us doing a dedicated 6-month elective block focused on research during some portion of the PGY4 year. And then the grant will also support up to 2 years of postgraduate research training, and usually that's in some hybrid fellowship program where you spend 80% of your time doing research and 20% of your time doing clinical neurology. And so I can tell you about my pathway, and we also have another member of the track, Fat Wen, who's with us as well, to tell you about his training and pathway. He's just a year behind me in the program. So this is kind of the pathway that we've been on. Just to tell you, I think that it's been a successful program, and Jason or our chair, Tom Carmichael, could illuminate the history of the track better than me, but it began in 2009. So over the last 17 years, there's been 22 awardees who've earned the R25, now called the UE5 grant, and 10 of those folks have gone on to earn K awards. 15 of the people who've earned those grants in our department have earned academic faculty placements, many still at UCLA, although some have gone to other impactful positions elsewhere, and a couple to industry as well. So we think that the track record of training is strong, and folks who are in this environment are prepared for the next stage of research beyond residency and fellowship. And so if you're someone like me who's committed to a physician scientist career, you're interested in research on new diagnostics, new therapeutics, you have a research background in the past, you want to build a network of like-minded colleagues at various career stages, further along or coming up behind, there's a great synergy, I think, of research and clinical care that we found in our department, and we think that we're all science nerds at heart. So I think this is my second to last slide. These are the current members of the track. The asterisks are those who've earned the UE5, and then there's folks who participate in the track who applied and maybe weren't successful, but have found other ways to continue with their research. There's an internal mechanism for departmental support, and then many people will concurrently apply for grants from nonprofits, fellowships, other NIH-sponsored grants. So I listed not just the members of the track or recent alumni, but also the mentors, in case you're interested in reading about faculty and the research that's happening on campus, people that have been mentors for folks in this pathway in the past. So many people have gone ahead of me, and those people have been incredibly helpful in mentorship and helping me along the way. And I think we're glad to continue that tradition. And sorry to pause once more, Adrienne, if you can go back. There is another QR code if you're interested in our research on this topic, facilitating greater interest in the research track. We do have a survey that we're conducting on people who we give this this interest seminar to. So if you want to fill out our survey on your interest in the pathway, we'd love to get more data for our own research.
Leave it to the research track.
Yes.
To do research on the track.
Exactly. The last slide is just to advertise. We do quarterly meetings, like I mentioned, and so some of the topics that come up. Here's our emails for Jason and I, and I'm sure Fat wouldn't mind sharing his email as well. But I'll pause here, and if there's no specific questions, Fat and I can give a brief kind of elevator pitch on what we're doing. Mita had already been called out in the educator track, but she's a noted current member of the research track as well, having earned the UE5 grant most recently, and will be starting her research soon. So we're happy to take questions.
I think something else I really love about this slide, as you can see, several years ago, some of our residents who went down this path are now mentoring, are on our faculty and are now mentors to some of our current trainees. So it really is great to see. Yeah, as Bill said, many of the residents who have walked this path have ended up staying on our faculty here at UCLA. So really a great pipeline. Continuing to give back to our trainees as they move forward in their very successful research careers. All right, I'll pause there. Fat, do you want to tell us a little bit about sort of your experience and maybe give us, a little, elevator pitch of what you're studying? Oh, no, we can't hear you.
Can you hear me now?
Yes.
Oh, shoot. I hear my own. Sorry. Give me 1 second.
Maybe I'll do the elevator pitch then. I did my MD PhD at Loyola University in Chicago, and came to UCLA for residency, having known about the R25 pathway at that time. So it was a goal of mine to apply for this grant, even as an intern, and I was meeting with faculty throughout intern year and PGY2. Chao Peng has been my mentor, who's a PhD neuroscientist in proteinopathy research on Parkinson's and Alzheimer's. And this was similar to my background. So I study alpha-synuclein and tau, which are proteins that cause Parkinson's and Alzheimer's disease. And I use cell and animal models. I'm interested in traumatic brain injury. My clinical work is in sports neurology. So a lot of concussion, mild traumatic brain injury, sometimes spinal cord injury or peripheral nerve, but mostly brain injury. And so I'm interested in neurodegeneration that can happen as a late consequence of traumatic brain injury. So I'm hoping to study things like CTE, chronic traumatic encephalopathy, going forward. Anyway, are you ready now, Fat?
Yeah, I think so.
Cool.
Apologize about that. I'm trying to multitask and pipetting and listening into this. So I had it on my phone and my computer, and that's why I didn't mute myself before. That was me, guilty as charged. Anyway, hi everyone, I'm Fat. I am, just like Bill said, just a year behind him. He was actually my senior at some point. But yeah, my background, I did MD PhD as well at WashU, studying pathogenesis of Alzheimer's disease in the context of ApoE, and then came here basically with the intention of continuing, studying for understanding the pathogenesis, but also therapeutic approach for Alzheimer's. So and I went here for undergrad as well, and it was a great experience. So it makes sense for me to come back. Yeah, so for my research right now, my mentor William Yang, so he's actually he's a bigger guy in Huntington's research actually, but recently started doing some work on Alzheimer's as well, and I've it basically put two and two together. I'm interested in astrocyte, so the glia aspect of Alzheimer's, because I think it's a little overlooked and less studied. So put together a proposal, involved some basically super resolution microscopy and genetics to kind of understand how these glia cells that used to be thought just like the glue that keeps the brain together, how they contribute to the disease progression, and hopefully at some point we can understand how that works and intervene and maybe come up with therapies. But that's my project.
Great. And Mita, maybe we will toss it back to you to share a little bit. Mita just finished her 6 months of clinical work, and her PGY 4-year is now in the lab. Maybe you can share a little bit about your project.
Yeah, absolutely. So actually it was really helpful to go through the track, partly to like refine my research question also. I came in already with passion and interest in researching ALS and ALS neurogenetics specifically. But there were several aspects, I was interested. One of my career goals is looking at racial and ethnic diversity of genetic data sets, and specifically as that applies to ALS. So that's a big interest of mine. But for the R25, UE5, I focused more on looking at polygenic risk scores for patients with FTD ALS spectrum disease, and looking at the association of that with potential motor symptoms of motor neuron type disease versus Parkinsonian type motor neuron symptoms, and reaching towards my interest in ALS kind of that way. And so I think it was a learning process for me in terms of really taking a step back and seeing, who are potential mentors that I can work with here? Where are projects that I can get involved in that I can be efficient and effective enough within the time frame that this grant is funding? And then, how can I link that back to my passions? And so going through that process was very enlightening, and super, appreciative of all the support that received from the leaders of the program in order to do that. And I'm just going to say, for aspects of research that perhaps I'm not doing through the R25 program, just going through this process and being linked with other faculty who are doing research in those areas, you can still do research, and you can still build those collaborations. You can still work on projects. So I think it's just a win-win kind of all around.
Thank you so much. Maybe we will open it up to questions here. We have about 10 minutes left before we switch gears. Jacob, you have a question.
Hi. Yes. Thank you, Dr. Flavin. You mentioned a couple times industry, which is something that I've really not considered with my personal experience with neuroscience research. And I'm just a bit surprised that people can end up in industry. Do you mean that they do so after a fellowship or right out of residency through whatever means?
Yeah, well, I guess it's a less common trajectory. I've known one of my colleagues who's gone down that pathway, mentor of mine, one of my senior residents, Anthony Linares, who did his MD PhD here at UCLA, and then stayed on for his residency here. He continued after residency doing the R25 and a clinical fellowship in neurogenetics. His mentor, he was listed on that slide, his mentor is actually at Caltech. The MD PhD program at UCLA is affiliated with Caltech. And so some of even the graduate students do their research at Caltech before they come back to UCLA to do clinical training, to finish their clinical training. So Anthony was involved in neurogenetics, and I think, was torn between continuing the academia approach and becoming a faculty member, starting his own lab. At the last minute, I think he got an offer to be in clinical and research development at a pharmaceutical company or biotech company called BioMarin, which is up in the Bay Area, interested in neurogenetics and orphan diseases. And so I think it fit with a lot of his training, that he could have a hand in both basic science and clinical trials that are ongoing from an industry perspective. And in the end, I think that that's what swayed him. So I think that taking that pathway, he's not involved in seeing patients, at least presently, although maybe that will change in the future. I do know of a former faculty member who's since left UCLA, who works at Genentech, also in the Bay Area, but does have a role still in clinical neurology through Stanford. And so I think there is a possibility to continue even with patient care when your primary appointment is in an industry setting. But you're right that it's something that is less common.
Gotcha. Thank you for mentioning that about the patient care too as well.
Yeah.
Appreciate
Yeah, I guess you think, industry may be a much more common pathway for PhD scientists who are involved in research one way or the other, whether it's in an academic lab or a industry lab. But as physician scientists, I think most often we're tied to academic institutions because that's the kind of easiest place to do both types of work. But if there's a will, there's a way. I think there's opportunities in different places for sure.
Absolutely. Thanks.
Nimansha, I see your hand raised.
I have a question about, for those of you that may have come into residency maybe a little bit more undifferentiated with clinical specialty interests and fellowship thoughts, how did you balance that in terms of understanding clinical interests and then finding mentorship and projects and developing those later on for your UE5 grant?
I can talk about my own experience because I think although I had this prior research experience in neurodegeneration, I was unsure if I should pursue movement disorders, for instance. Parkinson's disease was my first love, I would say. And I did a lot of elective time in movement disorders as a medical student and as a resident. And then I thought about behavioral neurology to work with dementia patients, and my research interest could certainly fit in that field. Even neurogenetics, given the focus often on genetic forms of dementia as a way to learn about idiopathic disease. Ultimately, I settled on sports neurology, which I think was unconventional, but very unique to UCLA because it's one of the few academic institutions where this fellowship is offered. And it builds on my prior experience as an athlete. I grew up playing football, so I kind of have an interest in working with this population of patients who are involved in, unfortunately, in traumatic brain injury or exposure to repetitive head impacts in a non-concussive format. And thinking about how to reduce risk of long-term neurodegeneration. So I tried to discern with the influence of my past research experiences, which clinical pathway would give me the most fulfillment and alignment with that ongoing research interest, but kind of help me find my own pathway. So I think I was able to find that, but it's obviously always a work in progress.
Yeah, I can speak to that a little bit as well. I was in a similar boat in a sense that I came in thinking you do neurology and outpatient is basically what you want to do. But then through residency teaches you a lot of things, among which I realized I actually like inpatient much better. So I was like, okay, maybe I should do stroke, I should do epilepsy, I should do neuromuscular. These are serious considerations at different times. I would have been happy to do any of those, honestly. But in the end, my love for research, and particularly, it's definitely with dementia and neurodegeneration, and I wanted to do that. And I guess as I have more time to do elective, particularly on dementia clinic or memory clinics, and I realized I like it more than I thought than the other outpatient subspecialties. So in the end, it sort of works out. But what the advice I get, and then I talk to faculty along the way. Our chair, Dr. Carmichael, is very involved with this whole process, and lots of advice were given. And basically, it's just difficult to keep up with two separate body of literatures. You want to be the expert in something, and it just kind of works out. It should be kind of congruent between your research and your clinical practice. I didn't mention before, but yeah, I'm also in the neurobehavior fellowship training as part of the R25 or UE5 as well. And yeah, it's going great.
See, Puya has a hand up.
Yeah, thank you. I wanted to ask about like the types of research that are being done and like what proportion of them is more like basic science. And I know there has been this propensity for basic science research to receive more funding in terms of the R25s or UE5s, but are there people who are more following clinical research? And to kind of follow up on that, has there been like any opportunities for digital health research as well?
Mita, I don't know if you want to talk about Tim's work, how familiar you are with his training.
Yeah, so one of my mentors, Dr. Tim Chang, also went through this, the R25, and we share our mentor, Dr. Gashwind, as well. But he has done a considerable amount of computational-based research utilizing the EHR. And so it's kind of a mix, taking advantage of his background and his skills and computational research techniques, and applying that to his interests at specific data sets utilizing the electronic health record. And, specifically, I know they looked at during the COVID-19, like when it was very active, they were looking at specific research questions there. So I think it can be very broad. I don't, however, know if that was through the R25, but that is a main like research aim that is part of his lab and his current work.
Hi guys, so sorry I ended up getting double booked. I apologize, but I was eavesdropping and it looks like Bill covered most of the critical issues, but I'm so delighted to see everybody again and happy to answer any questions.
I don't know if that answers your question, Puya, or if there's other perspectives. Jason, the question was about maybe a bias in R25/UE5 to fund more basic science rather than translational, clinical, data science in the past. So we talked about Tim's background and his ongoing work. I think another of the current fellows that wasn't able to make it tonight because he's in clinic is Brian Hickman. He's a fellow Notre Dame graduate with me. He's interested in epilepsy and is doing an epilepsy fellowship, but his research is oriented more toward epilepsy as a risk factor for, or seizures broadly as a risk factor for progression of Alzheimer's disease. And he's working with Keith Fossel here at UCLA in this regard. I think we'll be utilizing some clinical data as part of his work, although he could speak to it more in a more educated way than I could. I think most of us have done basic science projects because that's kind of been our training in the past. I think of myself as a basic cell biologist, and that's kind of what I'm doing. But I think if you're coming in with that type of training and background and interest in continuing, there are plenty of folks beyond our department at UCLA that are engaged in that type of research.
Yeah, I would say I don't think it reflects a bias other than we have so many unanswered questions about the fundamental processes in neurologic disease that some of them have to be addressed at the bench level. The one challenge that, and I think that program broadly at the NIH level is interested in identifying and funding leaders in neuroscience for the next generation. So one of the problems that often can come up in clinical research activities is that the work can be somewhat gradual in its nature. And so when we engage with fellows who want to do that, the important thing to identify in your work is to make clear the long-term impact of your research and craft a project that drives at that underlying pathology. And we could certainly ask and answer questions at the human level that reflect that. But sometimes the mentors provide just the nature of the interactions, the work looks very stepwise, and that's not what the NIH is interested in doing with this program.
Great. Well, thank you all for joining to share your experiences. Thank you, Jason, for jumping in with that bigger picture perspective at the end here. We're gonna change gears now to our next track, which is going to be our Equity, Diversity, Inclusion, and Advocacy track. And so I'd like to welcome two of our track leaders, Mirella Diaz-Santos and Jenny Lee. Oh, and there's our third track leader, Carla Minota as well. So I'm going to share my slides here. You guys feel free to tell me when to advance.
Sounds good.
And thank you for joining.
Hi, everyone. My name is Jenny, and I am one of the fellow co-lead, and I'm happy to introduce the UCLA Neurology Residency, Equity, Diversity, Inclusion, and Advocacy track. I'm here along with Dr. Mirella Diaz-Santos and also Carla Minota. And if you guys want to say hi, please do so. I'm one of the headache medicine fellows.
Former chief resident.
Yes. Hi.
Yeah, I guess we'll just say hello briefly here. I'm Carla. I'm a second-year headache fellow as well. Also trained here, was here for residency. And it's slowly but surely we've all sort of been building up this little track here in the residency program. And yeah, I'm happy to answer questions, and I'll talk a little bit more as the slides advance.
And hi, everyone. I am Mirella Diaz-Santos. I'm an assistant professor here in the Department of Neurology, and I'm a neuropsychologist by training. And I just joined these two amazing individuals in the track this year.
Sounds good. And I want to first share the mission of this track. It's really the track exists to provide residents with the language and skills necessary to become leaders in patient advocacy in all healthcare settings and to ensure improved access, outcomes, and representation of all patients with neurological disease, independent of their race, ethnicity, gender identity, sexual orientation, religious background, or physical and intellectual abilities. So if you can advance the slide. There are, pillars we think that exist within the equity, diversity, inclusion, and advocacy track. And these pillars, we're really centered around 4 key areas. And the first one is education. Second one, community outreach, career development, and mentorship. So first of all, for education, we think that this track is to provide the opportunities for the residents to learn about the social determinants of health, which can impact access to neurological care, participation in clinical trials, as well as health outcomes across different neurological conditions. We also get to discuss the issues associated with lack of diversity within the medical field, within neurological field, and then ways to improve diversity in neurology. And to talk about the community outreach, residents will also have opportunities to both serve underserved communities and advance diversity within the neurology field. And in the next couple of slides, we'll talk about some of the opportunities. Career development is another big pillar of the EDI advocacy track. So residents will get to engage with various people who will share their unique career journeys and insight into the field of neurology. They can also provide guidance and inspiration for career advancements. So you'll learn how to be advocates yourselves and also pursue academic careers dedicated to EDI and advocacy track. And lastly, mentorship is a big thing that we emphasize within this track. So residents can identify mentors within our departments of neurology, but also receive support in connecting with faculty outside of the field of neurology. So any faculty members across UCLA, including the other departments, and also School of Public Health, or even national level mentors, as we can connect people. And next slide, please. Carla. I think you're.
Yeah, I was muted. I got the little flag there. So thanks, Jenny, for introducing. So yes, we kind of wanted to talk to you guys a little bit and sort of present some of the opportunities and projects that residents engage with throughout, their experience in our track. With respect to community outreach efforts, we have established a pretty wonderful relationship with the Venice Family Clinic. This is a free clinic that's UCLA associated in the Venice area. It's primarily primary care, and they treat patients who are underinsured or uninsured. There is some neurology presence, and that's where we come in. On a monthly basis, there are 1 to 2 neurology clinics that happen there, generally after hours or after typical business hours. And there are a couple faculty members that are volunteers there, and we join them as well as volunteer residents or fellows. It's pretty open to everyone who wants to participate. And it's a really wonderful opportunity to connect with the community, treat patients that are different from the ones that you see on a more regular basis in the Westwood area or the Ronald Reagan campus. And I think all of us who have been part of the Venice Family Clinic really sort of enjoy it. Life there is a little bit more simple. They use things like paper charts. So it's a little bit different, but it's really nice to get to kind of work with this patient population and hopefully, impact their health in a positive way. There are other things that some of us have participated in, healthcare fairs. Dr. Diaz-Santos does a lot of this, and she has a lot of projects out in the community. She partners with community leaders, and she'll tell you a little bit more about that as well. But this is also kind of another opportunity to connect with the community, and this looks different for many of us, and our involvement has varied throughout the years. Some of the projects are led by the medical school. Some of them have been led by some of the different residency programs as well, internal medicine. And that's another outreach opportunity. With respect to projects and research, there's always, certainly the currency in academia is to do projects, to write up papers, to present things. And so we are very, we very much want to make this part of our track as well. And we've had quite a bit of residents publish on health services research. On a yearly basis, we have a research conference within UCLA, Collins Day. And during this conference, we generally try to advance some of our projects and present them to the faculty here. So that's sort of the educational bit of our track as well, making sure that we're sort of pushing that research agenda as well. And with respect to career development opportunities, there are plenty. These are just a couple of examples that you guys, if you were to be interested in this, could be part of. So there's Neurology on the Hill, and one of our residents is here, of course, Alvin, our chief resident, one of our chief residents, you guys probably met him. He is going to be representing at Neurology on the Hill soon, very soon, next week, I think. But he can tell us a little bit more about that. But in any case, Neurology on the Hill is sort of one of the, quintessential conferences that happens within the neurology world, where you get to advocate, meet Congress folks, and kind of learn a little bit about policymaking in healthcare. There's the National Clinician Scholars Program. This is also a postdoctoral fellowship that some of our alumni have been part of. It exists across the nation, and there are different institutions that participate in it. I believe Yale is one site, University of Michigan, maybe UPenn, UCLA is a site as well. So that's also a really wonderful opportunity to sort of develop a career in this. And Palatucci Advocacy Leadership Forum is another rather competitive forum. It happens over the course of a couple of days. It's open to generally more at the attending level or fellow level. Do they accept applicants? But residents are certainly encouraged to apply to this. And this is also an opportunity to build those leadership skills within advocacy. Thank you. And then this is just a little chart we put together to kind of show you what the goals with respect to like the agenda and the goals that we have for our participants in the track. So we definitely want to make sure that we're all showing up for each other, for the track, that we're trying to do the most we can to kind of continue to advance the track. PGY 1 year, of course, internal medicine year or intern year is there's a little bit of a disconnect because we know how that goes. You're generally just embedded in the in the medicine group, but we definitely want to establish relationships from early on with you guys. So all our lectures and meetings are available or will be available over Zoom. You can always connect virtually or come in person to our in-person meetings. You will have access to all of the resources and documents that we have. And if early on you want to connect about a project, we're always open to that. During the PGY 2 year is probably one of the harder years, like PGY 1 and PGY 2, I would say, with respect to schedules, is a little heavier. So the commitment is not massive. We ask that you come out for the track meetings. In addition to that, maybe do 1 or 2 days at the Venice Clinic, or if you have another interest, a different interest with respect to outreach programs, 1 or 2 should be just fine. We want you to be able to attend at least 2 of the journal clubs. And then to complete, we're in the process of trying to establish sort of a more regular curriculum within our track, in which there are resources like the ACGME Equity Matters Foundation's program. And we want everyone to be able to kind of go through that and learn for the purpose of learning the language and some of the skills that are required for kind of participating in these spaces and really advocating for patients, as well as colleagues within this space. So for the PGY 3 and PGY 4 years, I won't go into terrible detail about this, but there's a little bit, we expect a little more commitment, so a little more in the way of participating in the community outreach efforts, maybe leading some of the journal clubs, and certainly the Collins Day presentation for the PGY 4s is one of the goals. And this is a little bit more around the meetings and the agenda. So we plan on having, at least as of now, we have 4 meetings per year that are pretty well established. Sometimes we feel like that's insufficient and we want to meet more, and generally we meet in person and like over food and whatnot. So I think there's energy to make these happen a little bit more, but you are in residency, I'm in fellowship, Dr. Diaz-Santos also has other commitments. So we're trying to not burden you as much, but also have this opportunity to kind of connect in person. And during these in-person meetings, one of our goals is to have speakers from other domains, from other maybe divisions, and kind of connect with them similarly over our goals, our track goals, and to learn from them as well. Journal clubs, as I mentioned, the goal is to do some of these, certainly most of these in person, and hopefully have like an invited speaker, an expert on the topic. And regular check-ins to talk about projects and making sure that your goals are also being met for the duration of residency and the time that you're with us. Alrighty. Jenny, is this?
No, Dr. Diaz-Santos will present this.
Thank you. Hi, everyone. And I'll be short because I'm very interested in engaging you all in a dialogue, your questions. My understanding after having the pleasure of meeting some of you in the interview process is that this track is very unique in many ways, because we have the pillars of social justice, equity, and I am a fellow, like a former fellow of UCLA in the Department of Psychiatry. as a neuropsychologist. So I was trained in the whole aspect of social responsibility, equity, and that's my whole work. So I do CVPR and / health services research. So that's why the team were mentioning that I'm always with community and always doing engagement and try to understand what are the gaps in healthcare that are being sustained through generations that different communities suffer till this day, including access to health insurance here in Southern California. So I just wanted to say that I'm grateful that we're here, that I'm here with all of you, that there's a lot of opportunities in the sense of all the pillars, but I'll be just like telling you a few things. So when we talk about mentorship, the aspect of equity, diversity, inclusion is like a part of the mission of the whole School of Medicine, as well as North Campus. And we have a really good relationship with different departments, including the CTSI, the Division of Health Services Research. There's a lot of resources here at UCLA that even faculty here at UCLA are not aware of. So there's a lot of resources, a lot of connections, a lot of opportunities for your own clinical teaching and research goals if you have all of them in order to keep in line with your professional aspirations. So I'm just going to stop there because I tend to talk a lot and I'm interested in what you are all thinking and all the questions that you all have for us.
Great. Thanks to all of you so much for joining and telling us about the track. As Carla mentioned, Alvin is here too on the Zoom. So maybe while you're thinking of your questions, maybe putting things in the chat, I'll invite Alvin to share his experience doing some health disparities research, and also, Neurology on the Hill is next month in February. So maybe you could tell us a little bit about the process, Alvin, of like applying for that and the training that comes ahead of that to prepare you.
Sure. Hello, everybody. Hello again. So in terms of the research that I've been committed to, most of my work focuses on addressing health disparities, particularly exploring how social structural factors such as race and education level impact disease outcomes and access to care. So I've done work in specifically in Huntington's disease with my mentor, Dr. Mendizabal. I've also, and with Dr. Mendizabal, we recently also co-authored a literature review on disparities in neuropalliative care among minoritized groups. So that is about identifying key barriers to mistrust, systemic inequities, and cultural differences. So, and then in the end, offering actionable solutions as well. On the advocacy front, yeah, I'm really thankful to be accepted to Neurology on the Hill in February. So that's where I'll be, me and the California team will be advocating directly with policymakers for equitable healthcare policies. So that includes expanded access to neurology services, more inclusive approaches to patient care and research. And that's kind of been a part of my mission going forward. Some past issues that AN has really advocated for on this front has been supporting research funding for NIH, as well as supporting drug price transparency, expanding access to telestroke throughout our communities, and then other reductions in regulatory burdens as well, to really help improve how neurology and our healthcare system can be delivered to our patients effectively. So happy to answer any questions that come up as well.
No questions. Oh, Sultana, thank you.
I had a question. I was wondering for people who may have had some like prior community outreach experience in like the Los Angeles area, who kind of fit the vibe of like the underserved community members. I guess as a resident, if anybody had experience with that, kind of like transitioning into your role into this track and continuing to work with those people and like forming projects or like just like that outreach that we're required to do in projects with that group, and if we can do that.
Yeah, I don't know that we have many people who already had established relationships here like you have in your past, but I'll maybe let Mireia answer that question about sort of, connecting with community partners and how to sort of, get that off the ground and maybe turn that into a career. So Mireia, can you tell us maybe a little bit about sort of how you make those connections with community partners and leverage those, as part of your research and everything?
Yeah, absolutely. So just to make sure that I understand the question, so is it that you already have community partners that you're working with, right? And that you want to see if you can extend while in residency? I think that makes complete sense, but because why would you, like, we know that community engagement is all about building community, building relationships, maintaining those relationships, and that we also know that those relationships and showing our trustworthiness as individuals and physicians and scholars takes time. So you already have done the work in order to establish those that partnership. Therefore, if you have your stakeholders that said to you, these are the needs, absolutely, we have a platform to support you and any of you to walk you through the UCLA regulations and some of the red tapes on how to write that IRB. Like, we know people throughout the different departments that have been doing the CBPR work. So, and then we have stakeholders within the IRB that can help expedite the process to minimize minimize the time of approval of the IRB so you can do that project. And that goes to anyone.
Perfect.
Thank you.
Oh, go ahead, Sultana.
Just thanking. Thank you.
Yeah. Great. Any other questions? I'm gonna leave some uncomfortable silence. Paul, great.
Thank you so much. I was wondering if you could talk a little bit about with partnering with communities and working with the community about potentiality of like bringing communities into our spaces, such as like in lecture halls, or so to talk about stroke, or to have youth come to see like what the hospital looks like and encourage them to experience medicine, things like
that. Jenny and Carla, do you wanna share, or do you want me to go first?
You can go ahead. I don't know.
I'll let you take it.
Yeah.
Okay, just checking. So I can speak from my, like, I am within the division of the program of Alzheimer's, right? And there are several initiatives, and I know that Jason was, Dr. Hinman was with you a few minutes ago. So we have some initiatives that we're partnering with high schools, for example, to expose this high schooler from historically minoritized and disenfranchised communities to know what a career as a neurologist or neuroscience, like, is kind of like exposing them to representation of what is it like to have a career in a STEM field. And this also aligns to with current efforts happening at the North Campus, because we are, I think that we already met the HSI, the criteria to become an HSI institution. And there's a huge emphasis on STEM related fields. So we can speak on those opportunities of how to bring communities to to Westwood, but most of the cases, at least for aging, that's my field, we typically go to our community meetings and stakeholders organizations to meet them where they are and whether they're able to come with some resources that we can provide.
Yeah,
I don't know if you answered the question.
Yeah, I'll just add that there is a like K through 12 program through Charles Drew, where basically children come on Saturdays to campus to get sort of exposure to those STEM fields and to the medical field. That program is like long running and very well established. I don't know that any of our residents have like specifically gotten involved, but I know it exists. And I've been to one of the Saturday sessions. So there certainly is an opportunity there that already exists, bringing K through 12 students to campus to sort of get exposed and excited about potential careers in STEM and in medicine. I see another question in the chat, so I'm going to go ahead and read it aloud. So Angela asks, she's interested in knowing if there have been past projects collaborating with clinical projects or even basic science research or other interdisciplinary collaborators. And maybe I'll just start by saying, I think in the last track, the research track, somebody alluded to the work of Tim Chang, who's also one of Mireille's colleagues in the dementia space. And one of the benefits of the expansion of UCLA Neurology into community clinics around Los Angeles is that we're trying to build sort of a clinical trials network where people who might live in communities, go to one of our community health centers, have trouble accessing campus, on the west side of LA, can still get involved, in a clinical trials network at like the local community clinic site through UCLA. And so I think that's one of the things that Dr. Chang has been involved in and partnering with our community clinics to do outreach into communities. And he does neurogenetics research. So he certainly is doing some like population health research as part of sort of this community engagement through our network of clinics. But I don't know if any of you want to share other examples, maybe.
I was going to say there are a lot of opportunities as well to kind of collaborate with the global health track, who I think I think they're coming on, but
they're coming there.
I was to say there are a lot of opportunities with them. I don't think any of us have yet established like a project with that track, but they do a lot of work, of course, that's around underserved communities, underinsured communities outside of the United States, within the United States even. And that's kind of a place where we can tap into as well to kind of advance some of these projects. So I think there is opportunity for interdisciplinary, even collaborations in that way. That's something that comes to mind, and that's a great question. I think we all kind of can come together in a lot of interest, and it would be interesting to kind of to brainstorm some of this.
Exactly. I didn't want to put Maria on the spot, but I know that she was just at a, outside of outside of the US. And then she shared her experience during our last meeting. So there are definitely lots of opportunities. I just want to make sure that you guys know that there are lots of supports and resources available. If you have a great idea, we're always there for you.
Yes. Stay tuned.
Yes, exactly. Good segue.
Yeah. Great. Yes, maybe with that, we will make that segue. So I want to thank Mirella, Jenny, and Carla for joining. And I'd like to introduce our global health track. We have Dr. Raj Mazumder, and I think Dr. Joy Chan will try to join if she can. And then yes, Dr. Hosseini, one of our PGY3 residents, will share her experience in this track as well. So I'm going to share the slides here and we'll get started. Great. All right. Raj, are you kicking things off here?
Yeah, sure.
Okay, great. Just tell me, yeah. Next slide.
Thanks. So welcome everyone. Sort of a brief overview what the track entails. Basically, do you want to go to the next one? Yeah. So, I jumped in the, sort of heard the tail end of the conversation about overlap with other tracks. So basically, these tracks are just guidelines, to sort of streamline availability of faculty members and resources, and creating sort of a group for like-minded people, and sort of a campus resource, I would say. So this is exactly what it is: a resource and a support system for anybody interested in pursuing a career or even an experience, maybe, and as they are trying to figure out the bigger picture of their life. And we defined it, given that there's a lot of overlap with health equity and inclusion. We purposely defined it based on the global health track on serving vulnerable population in low and middle income countries. So but as you will see, like even in countries where it might be higher income, but there are vulnerable population in that, if you are interested in serving a particular population because of your life experience, or you found an interesting experience through your like there are faculty members who are within UCLA who are doing a lot of work internationally, through that. This is all about basically trying to understand the system and that makes a population vulnerable, and trying to sort of gain experience and exposure in crafting ideas of how to, in the future, you want to address that problem. So this is basically part of the training. Our whole, so we are very supportive of any new ideas, things that we haven't thought about ourselves. So next slide. So the expectation within the track is very minimal in terms of given the there's for PGY2 and internship, you're extremely busy. So mainly involvement starts, you can attend all the meetings initially just to hear what everyone is doing, to get ideas. And then the third and the fourth year is when you have time developing a project that will culminate into either a QI project or even a reflection piece that allows you to sort of introspect or produce like a structured paper or something. We also expect people to sort of attend one of the global health meetings at the national conference, either through the AAN or the ANA. Next one. So these are our, sort of the long-standing, 3 sites that we have sort of institutional relationship with. Mexico City, we have a health program, exchange program, where residents from UCLA goes there, and then the residents from this, the Institute of Neurology and Neurosurgery in Mexico City, the most prominent neuroscience institute there, residents from there will come and visit us. So this is a bilateral exchange program that's supported by the Department of Neurology. And then we have, clinical and research experience that, we do through, my research group in Uganda. And then Zambia also, we have faculty members, Dr. Chan, and then Dr. Jennifer Adrizi, who have had a relationship and projects there. This is in collaboration with Dr. Deanna Saylor, who most likely is soon going to leave Johns Hopkins, as I understand, but still very much part of the Zambia program. And so she is our point contact there. So apart from these, sort of the long, sort of institutional relationship, you can create your own, and a lot of people have taken advantage of that. So, Dr. Hussaini can talk about her experience. Most recently, she finished a global health experience. Others have been, Mike Conerney, who is a IOM fellow right now in his residency. He has family ties with Bolivia, so he has developed a program that he thinks will will be a sustaining long-term partnership. And then our like Rebecca Jules, who has worked in Zambia, but over the last year she has been working with me as well in Uganda, in one of the projects in Uganda as well. So like it's there are, depending on how you are seeing a career path, the whole program is structured to promote that basically, and that's what our hope is. So next one. So this is, as I said early on, this is sort of the structure of the 4 years. I think I have sort of covered that, PGY3, PGY2, you sort of identify a mentor and site, whether it's through the existing program or if you have to create your own. Because this is part of a CGME funded project, there are administrative agreements that has to be in place. So that takes a lot of time and effort. So PGY2, if you're able to create, you only need to do that if you're going to create your own. So usually PGY2 and early PGY3, one has to do that if you're planning to do your own. And maybe Dr. Hussaini can comment on some of that because she did it. And 3 and 4 years is basically, the hope is you get exposed in PGY3 year to this site, and then hopefully go back to your PGY 4 year and do some scholarly projects. And UCLA has its own sort of global health funding opportunities internally. And then there is also like sort of a national scholarship through the ANA outreach scholarship that several people from our program has received that already. So these are, we have sort of experience with these things which we can help with. So next one. So this is our contact. Feel free to reach out with any question, and we are open to discussing and answering any questions you guys have.
Right. Thank you, Raj. Maybe we'll hear from 2 of our residents who have participated in global health experiences. Maria, why don't you go first and tell us about your experience, because you started a new site, so had to navigate all the bureaucracy.
I did indeed. Hi, everyone. I'm Maria or Mahdia. I'm a PGY3 in adult neurology. I'm part of the global health track. I'm also part of the EDI track, and I'll in a minute talk about how I'm kind of combining those 2 passions for myself. So I went to New Zealand. As you might have noticed, it's not one of the listed sites, and I went through kind of the paperwork process through UCLA and GME to establish that as a site. I have to say that if you're interested in going to a country that's not listed there, like for example, Mexico or Zambia, Raj and the whole, honestly, all of leadership is very, very supportive, and you being able to go wherever is safe. Essentially, as long as the country's safe, you're able to go. I kind of did this really fun dual experience in New Zealand. So I split my time between the public system as well as the community, just kind of because I wanted to get exposure to both. In the public system through University of Auckland, I did a neuro-ophthalmology elective, and I also did headache medicine in the community. I'm applying a headache fellowship, and so I kind of wanted to get a sense of what it feels like in New Zealand. Now that I look back, I think I was just kind of like dipping my feet in the water, and I plan to go back in PGY 4 year. But because of the experience that I had in New Zealand, I actually applied for a research grant to study the disparities that exist between Maori, which are the indigenous community in New Zealand, compared to the Kiwi population, which are the Anglo-Saxon European descendants in New Zealand. And the goal, I also have a big passion for health services research. And so it's a little unclear whether single payer models do actually provide more equitable care. And so I thought, I just went to this country that is much smaller. It's a controlled island. The healthcare system is less complex than that of the United States. And so one way to be able to kind of answer that question and facilitate country to country learning would be to specifically focus on studying how disparities affect migraine care in New Zealand, and then sort of apply that more broadly. And a lot of research has been doing in a lot of different countries. And so this is really just a small piece of a bigger picture, but that's how I'm combining my two interests. And I honestly had a lot of fun. And when you do global health work, you do very rigorous academic and clinical work, but next to it, you get to explore beautiful landscape and a country you haven't been to before. And there's absolutely gorgeous beaches, and it kind of looks like Hawaii. And so those, when you do global health work, those are also the experiences that makes it extra memorable to be involved in the track.
Great, thank you. Rebecca, thank you for joining us. Maybe you can share your experience, both going to Zambia last year and now with your plans in Uganda and involvement in that project.
Yes. Hi, everyone. My name is Rebecca. I'm one of the PGY4s.
Can you talk louder, Rebecca? Is anybody else having a hard time hearing her? Okay, it's not just me.
Sorry.
Your
I'll talk
microphone.
louder.
There we go.
I did a project in Zambia, and that was related with Parkinson's care. I'm going into movement disorders. So it was basically looking at some of the factors influencing like access to care, access to medication, and things like that. And that was with one of my mentors, Dr. Advocacy. So we're actually like in the process of, writing it up and possibly looking into applying for another grant to continue that project next year. So what we did initially, the project we're doing in Zambia was needs assessment. So then next year, we're hoping to kind of have some more implementation project, and we're discussing some implementation things that we can do related to physical therapy, access to medications, and maybe having what would eventually lead to a multidisciplinary kind of PD care in that setting. The great thing with Zambia is they are one of the few countries in that region with a neurology residency and some honestly pretty established neurological care in that region. So it was great to go there and learn how the program came to be and work. So 2 weeks of my time was actually in the wards as a resident. And then part of the time was interviewing patients with PD. So it was a very memorable experience, something that I hope to maintain as a long career goal of mine. And then next year, actually in a month, now I guess a month and a half, I'll be going with Raj in Uganda. And we applied for a grant, basically trying to create an app that is able to predict the best anti-seizure medication. Raj is an epileptologist, obviously. The best anti-seizure medication within kind of a more lower socioeconomic kind of context. There's been studies in the past that have used these sort of models to look at like in higher income countries, kind of like predicting like anti-seizure medication. So we're hoping to look at similar things, but like in a different kind of set of population, which is from our knowledge, the first time it's kind of been looked at. And eventually we're hoping to transition, I'm going into movement, like I mentioned, to really look at that population. And there's some Parkinsonism that sometimes develop in patients with seizures, and especially nodding syndrome, which is the population that Raj studies, and trying to really, one, characterize some of those like a movement disorder, Parkinsonism, kind of characterize it, and maybe eventually talk about what are some sort of intervention that could result from those. So that's kind of where I hope my career to go in the next few years, if not forever. I really love global health. I love global neurology. So I'm very excited to kind of see how that plays out in fellowship and early attendinghood. Happy to answer any questions, both here and offline. Anything I missed, Dash?
I had a quick question about the amount of time that you have. It sounded like it was an elective. So is that the typical elective span? And is it something that if you like it when you first do it during your third year, you can go back to the same spot during your fourth year?
It's so both mine were month long. So for Zambia, I think it ended up being a month, a few days. Same with Uganda, it'll be the same. It's actually encouraged to go to the same site. I think just based on preparedness, I couldn't do 2 sites consecutively. And it's a little bit, like, I don't think it's impossible. It's a little bit more challenging to do, I think, 2 to 3 months abroad within the schedule. But so that's kind of one of the limiting factors. If you do work in 2 projects, you might have to just alternate years or things like that. Yeah. And Maria, yours was a month too, right?
Mine was also a month. And I think when I go back, I'm also going to do a month, maybe plus a week, and have my clinic. Because as PGY 3 and 4s, you have weekly clinic. You could have someone cover your clinic and then maybe stay longer if you desired. But I thought the month was an appropriate amount of time to be there. And like when I come back, I just had a meeting with the founder of the Migraine Foundation in New Zealand, and like talking about the projects, and like, so there's things that you can keep doing while you're back in the United States. And just to like transition for a second, if you are part of the UC system, you can also apply to something called GloCal Health Fellowship, aside from like Forgotti and all of the other global health fellowships that are available to you. And it's very cool. So it provides kind of like a more structured funding program for post residency, if this is something that you find yourself being really passionate about and you want to pursue long term.
Any other questions? Yes, Paul.
Thank you so much, as always. I was wondering if you could talk a little bit about the preparation before you go abroad, of like cultural humanities specific to like that location, or language development if it's a different language, or things like that, if there's anything. Thank you.
I can talk a little bit about me. So I was very fortunate. So I think our year was maybe, so Dr. Adrisi had just gone like a few years before to Zambia. And in Zambia, there's many, I think like 70 different local languages, but English is like one of the languages. And most of the people I ended up working with, the co-residents, all spoke English. So that was very helpful. And you know, before we met with Dr. Adrisi several times. There was like a forum because there's such a good exchange between residents abroad, from the US to Zambia. It's not just a UCLA specific thing. So there's already some established material about the population, like what resources are available there. So she was able to share some of that with us. So that was a lot of the prep that was done.
I'm really glad you asked that question, because I'm actually, for when I go back, this is something that's relevant to me because I'm going to be studying Maori. I am now looking for the appropriate tribe leader to meet with so that I come from a place of humility and cultural sensitivity. And there's a lot of different tribe leaders. And so I'm trying to, because migraine and headache is not actually recognized as a disease entity in their communities, I'm trying to figure out, okay, who is the right person to ask when like cognitively this doesn't exist in their understanding of disease. And so it's a really good question. And it's something that I'm actively actually trying to work with like the Migraine Foundation to be able to answer. But in terms of language in New Zealand, they speak English, so that wasn't a problem.
Any other questions? I appreciate those of you on the East Coast for hanging with us. I know it's getting late over there.
I
But
think there's a question in the chat. Sorry.
oh yes.
Yeah.
Interested to hear the reasoning behind New Zealand. Did you have a connection there?
I personally, so I speak Farsi, Spanish, and English, and I wanted to go to a country that spoke one of those. And so I settled on English speaking, and then from English speaking, I just thought New Zealand would be cool. And when I went, I really loved it. I really enjoyed it. And so that's why I'm going to go back.
And it
But
was
like I didn't come in.
was it through some of our headache faculty here that connected you with the preceptor there, right? Is how
Yes.
we made that happen. Yeah.
So Dr. Peter Goadsby is a very well-known name in the world of headache medicine. He's my mentor, and he's actually is helping me with my current project. But I asked him if he has any connections in New Zealand, and so he helped create the connection with Dr. Ray Bowes, who was the community headache specialist that I worked with. He also is the person that connected me with the head of migraine center in New Zealand.
Yeah. So to set up a new site, really, as Dr. Mazumder said, you know, if you plan far enough in advance, you know, we can make it happen. What you need in terms of this paperwork is to have somebody at that site who agrees to basically be responsible for you and to be your preceptor. And so we are fortunate here at UCLA to have faculty who have international connections and who can facilitate those for us. And yeah, he was very welcoming, I think, right? And like really willing to participate in the process, signed off on all the paperwork super fast. So we were able to make it happen.
Everyone made it a lot simpler than it actually was. And that's the beauty of being a resident here at UCLA. It's the support.
Yes, Sultana.
I had a question for yeah. So because you created that new site and like if you were the first one to go, I know you had that connection. Was it a little bit harder for you to navigate once you were there, since it's kind of like a new program and integrating you into that, or did it just take you like a week and stuff and you got the hang of it?
I think it was a little maybe odd the very first week because like the first day I showed up to clinic, well, Dr. Bowes knew me, but in the neuro-ophthalmology clinic, I was like, hi, I'm a neurology resident at UCLA. I'm doing global health elective. And that was a new thing. Like they weren't used to hearing those words but the patients like it. And so then when the patients like it, the attendings that you're working with, they also like it. So I think for week 2, 3, 4, it didn't feel so difficult or a barrier or a problem.
Nikki, I think you had a question too.
Yeah, I did. Matthew, this is also more of a question for you. So, but for you and like for other people that kind of make their own path in terms of a global health project, how do you kind of ensure that it stays after you're gone?
That's a good question because I'm not gone yet. So I don't know exactly, but I think when you can clearly establish that you can take away something from that experience, whether it's an academic project, I'm doing a research project, or whether it's a positive learning experience, it broadens your clinical acumen. Because the health system, even if you don't do any kind of academic work and you don't do any kind of research, which most people do, but even if you don't do it, you walk away with a broadened clinical understanding of the world. I very vividly remember, like, when I came back, I was on my neuro ICU rotation. So I did my global health, then I was neuro ICU. And when I came back on neuro ICU, even though I'm not going to be an intensivist, I had a totally different perspective on my neuro ICU rotations, because I was like, the rest of the world is not UCLA. Like, and it just kind of gives you this perspective that you're not going to have access to the same resources that you have at Ronald Reagan, and it really kind of zaps you up. And I think that's something that's beneficial for everyone, regardless of whether you want to work in a very large tertiary care center with a lot of resources, or if you want to work with underserved communities in a smaller community space. You can learn a lot from doing global health. And so I think just like kind of sharing your experiences with your co-residents and also showing that you can convert this into academic currency motivates people. But good question, because we'll see after I graduate.
I will say from the administrative perspective, once we've established those, the AA and PLA with a global site, that's valid not just for Madia. So now if anyone else wants to do that, we already have those agreements in place with their institution. So it's much easier. But yeah, I think, through engaging in some component of academic work globally, you start to build collaborations that, even when we don't have a resident physically there, if we're collaborating through research, it just helps foster and sustain those relationships. Yeah, those are my 2 cents. Great. Well, in our final minutes here, anybody else want to add anything or ask any questions before we wrap up? All right, wonderful. Well, I want to thank all of our track leaders and residents who came in and out during today's meeting to share with you their experiences here in our program and participating in the special interest tracks. Hopefully it gave you a chance to also get a little bit more in-depth look about the opportunities that we have here. I want to thank all of our applicants too for joining. And for those of you who may be watching this asynchronously later, we included everyone's email addresses in the slides, so please don't hesitate to reach out if other questions come up. We're sort of in the final stretch, heading toward match day. So as you finalize those rank lists, if you have other questions, please don't hesitate to reach out. I'll also just take these last minutes to remind you also next Thursday at 5 p.m. Pacific time, we'll be having our webinar with our internal medicine colleagues talking about the intern year experiences affiliated with our program. And we have several of our interns who will be joining to tell you how they're liking their intern year. And then on February 21st, we'll be having the very optional in-person second look opportunity. If any of you would like to travel to LA, we have an afternoon of activities planned for you, finishing off with a happy hour with all the residents. So if you'd like to come visit us, Sahar, we'll continue to send email reminders about these upcoming activities. But hope you all are staying safe and staying well. Yeah, wish you all a good night. Thanks again.
Thank you.
Thank you.
Good night.